You write a lot about the Nutritarian approach. So in your books, you describe that for maximizing metabolic health. Can you give our
Right.
listeners insight into what the Nutritarian lifestyle encompasses and why it's beneficial specifically for people living with type 1 diabetes, prediabetes, and type 2 diabetes?
Well, number one, it reverses prediabetes and type 2 diabetes. Yeah, I'd say it reverses prediabetes in 100% of cases, and it reverses type 2 diabetes in probably, in my experience of 25 years with thousands of patients, about 90%. And the reason it doesn't reverse diabetes to normal in 100% is because some people with diabetes for 20 or 30 or 40 years have used medications like these sulfonylureas that overwork the pancreas so hard that the beta cells almost have no function left. They're almost like a type 1.5. They were originally a type 2, but now they're almost a type 1 because there's no beta cell function left. So they might still require a little bit of insulin, and they're not totally reversible. But my experience has been, and the study I published already on this subject, was that that's only 1 in 10 type 2 diabetics. So they even have people in their 80s with type 2 diabetes for 20, 30 years, the majority of them still become non-diabetic. And I'm defining non-diabetic as being normal glucose readings with a hemoglobin A1C below 6 without the need for medication. They still have the same tendency to become diabetic if they eat poorly and become overweight again, but they don't have diabetes if they're eating, if they're living and eating normally, and their blood sugars are normal, and their weight's still staying normal, and their glucose, they don't need medication. Now, for a type 1 diabetic, when I wrote the book, The End of Diabetes, and some type 1 diabetics and their parents have objected to that I didn't say the end of type 2 diabetes specifically, because they're saying that type 1 diabetes has nothing to do with diet. You're not going to end it. You're not going to get rid of it. And this book is not about them. And I'm saying, no, that's not true. First of all, this book has to be read by the type 1 diabetics because it's the type 1 diabetic that needs it even more. Because now I'm not saying we're going to wipe out type 1 diabetes. The person still is going to have diabetes, but the amount of insulin they're going to require to keep their blood sugars favorable are going to be less than half what they would have by eating more conventionally. And in most cases, my patients and those type 1 diabetics following a Nutritarian diet need only 1/3 the amount of insulin they had required in the past. It stabilizes their glucose at low levels. They don't have any highs and lows anymore. And they don't have to keep measuring and shooting themselves so much. They can exercise more without pumping in more. They're much more free to not worry about lows so much, and they're much more free to worry about highs. And they keep their diet, well, we do want them to keep their diet relatively consistent, their exercise habits relatively consistent. But the point I'm making right now is that type 1 diabetes can be a death sentence where people can become blind, they can have leg amputations, they can go into kidney failure, they can lose brain function early in life, they can have early life heart attacks, and they've generally seen as having a dramatically shorter lifespan with incredibly more morbidity and tragic problems that happen to them at younger ages. And I'm saying that those things don't have to happen, and that a type 1 diabetic can live to be 100 years old without heart attacks, without mental shrinking of the brain, without becoming blind, without getting infected feet. They can be perfectly healthy because it's the excess insulin that's been thrust on them by the endocrinologists in the diabetic community, because they're taught by this community of type 1 diabetes, just eat whatever you want and take enough insulin to keep your sugars in good control. And if your sugars are good in control, you're okay. But that's not okay, because it's the excess insulin that's going to shorten your lifespan, just like the excess insulin shortens the lifespan in the type 2 diabetic, and just like excess insulin shortens lifespan in the non-diabetic. Overweight people who are non-diabetic, they're not diabetic because their beta cells in the pancreas can push out huge amounts of insulin. But just because the beta cells in the pancreas is capable of producing huge amounts of insulin, and they're not diabetic, doesn't mean that insulin is not causing damage. It's not causing cancer. It's not promoting cancer. It's not promoting brain disease, not aging them. It is aging them and causing them to be overweight. But in any case, I'm giving type 1 diabetics the excitement and the confidence that they can live a life without fear and without having a shortened lifespan, to have a happy and healthy and vibrant life. But they can't eat American food. They can't eat pasta and bread and oil and cheeseburgers and pizza and expect that to happen, because they're going to require more insulin, and that extra insulin is going to be damaging them. But the type one, diabetes is not damaging them. It's the extra insulin. So they have to eat a diet that is low and that's a lifespan promoting diet, which I call a Nutritarian diet. Because a Nutritarian diet doesn't just look at one aspect of lifespan promotion, it looks at every aspect of lifespan promotion, so the diet maximally extends human lifespan. For example, we know that, and I mentioned this earlier, that the only thing proven to radically extend lifespan of all animals, including primates, and I'm saying proven in a sense that it's been shown in study after study after study, and that's caloric restriction and reduced frequency of food consumption. Caloric restriction and reduced frequency of food consumption in an environment of micronutrient adequacy. We want to get insufficient micronutrients, vitamins and minerals and phytochemicals, but we want to do so in a moderately lower amount of calories. In order to do that, we have to intelligently pick foods that are rich in nutrients. We have to intelligently pick foods that give us the wide breadth of nutrients humans need. And what I've shown in the studies I published with large numbers of people, we're talking about over 700 people, is that nutritional quality of their diet, their appetite naturally goes down. They don't want to eat as much food. They're satisfied with less calories. So eating a lot of high nutrient foods makes you satisfied with a lower amount of calories too. So it all works together so people don't have to struggle. They can eat what they like, but they'll naturally consume less calories because they're eating foods that are richer in nutrients, like GBOMBS. So I came up with the acronym GBOMBS. GBOMBS stands for greens, beans, onions, mushrooms, berries, and seeds. I want people to remember very easily those foods I want them to eat on a regular basis, on a daily basis, because these foods have documented effects to extend human lifespan and to prevent cancer. And we put to each one of these foods individually has powerful effects to reduce risk of getting cancer. We put a dietary portfolio together to include all the powerful anti-cancer foods. Then we fully maximize the body's abilities to use these phytochemicals and antioxidants to extend human lifespan and not to have happen to us what happens to other Americans. So it's simple. I'm not saying GBOMBS is everything you need to eat. And I'm not saying it's the only tool you need to know about nutrition, but it's just one helpful tool added onto the other helpful tools. Eat your greens, eat your beans, eat your mushrooms, onions, seeds, and berries.